Hi, I'm Hun from Phang Ngọc Thạch University of Medicine, and this is my research presentation, an evaluation of antibiotic administration to COVID-19 in patients at Nguyễn Tri Phương Hospital, Vietnam. This presentation will include the main content as shown. In 2021, studies have shown that the rate of co-infection and superinfection in COVID-19 patients were relatively low. However, the prevalence of antibiotic use was significantly high. Langford's meta-analysis shows that up to 75% of patients with COVID-19 were given an antibiotic, but only 8% of them were confirmed with bacterial co-infection. In Vietnam, the fourth COVID-19 wave started from April 27, 2021. During the peak period of this wave from July to October, Ho Chi Minh City was under a strict lockdown when all COVID patients were admitted and treated in hospitals, including Nguyễn Tri Phương Hospital. This leads to a research questions that without any official guidelines in managing COVID-19 patients with secondary infection and antibiotic treatments, is the antibiotic therapy used considerably reasonable, and what factors tend to affect the duration of these antibiotic treatments? We aim to assess antibiotic use in COVID-19 in patients in the pandemic context, specifically determine the prevalence of antibiotic use and factors affecting the duration of such treatments. This retrospective cross-sectional study involved reviewing the health records of COVID-19 in patients who were at least 18 years old and treated with antibiotics. A chi-square test and binary logistic regression were conducted to determine whether there was an association between antibiotic duration and other variables. Results indicated that the majority of patients were female, over 65 years old, and had at least one comorbidity. And due to the lack of guidelines, most of the cases used antibiotics empirically or prophylactically to prevent secondary infection. Antibiotics were administered as monotherapy or in combination. Levofloxacin, ceftriaxone, and imipenem silacetin were the most frequently prescribed antibiotics. The most common treatments used concurrently in all cases were anticoagulants, corticosteroids, and antiviral medications. And patients who were not concurrently receiving antiviral drugs were more likely to require extended antibiotic treatment. In conclusion, levofloxacin was the most popular option of empiric antibiotic treatment. The data demonstrated that combining antibiotics and antiviral drugs influences the duration of antibiotic use. This study emphasizes the importance of treating the primary disease and that antibiotics should only be used when microbiological evidence is available. Thank you for your attention.